everyone, and welcome to my channel. This is Dr. Tidman. Thank you for taking the time to stop by. This is the first part 1, of my new Caregiving 101 series posted summer of 2025. I hope it proves to be beneficial and educational for you. I would highly recommend you take out a notepad and take some notes. This part 1 is going to be pretty loaded with information. This series is based on my 45 plus years in healthcare practice and on my 2 books, Families in the ICU, A Survival Guide, and Families in the Rehab Center and Beyond. Both of my books are available on Amazon, so check them out. These books were developed from a growing concern that families were lacking critical information to assist them while their family member was in a hospital or a rehab center. I personally have a burden for these families when attempting to transition their loved one to home after an injury or illness, and the tremendous stress this places on the family and the patient. I have lived through this with my own mother. These transitions can be very stressful. Therefore, I thought it would be a good idea for my YouTube audience to post a caregiving series. Now, this isn't a comprehensive series, but I think I will be adding to it in the future. These videos are short and they're general overviews, but they give you some ways to get started on what you'll need to do if your loved one is in a hospital or a rehab center. Be sure to hit the subscribe button and the notifications so you're notified of when the additional parts in this series are posted. So it's a broken hip, or your father has had a stroke, or your husband has been in a serious car accident. So now they're in the hospital. What do you do? Who do you ask? Where can you go for information? This brief video is going to go through the answers to some of those questions. We're going to talk about in the hospital setting, who are the personnel you'll be dealing with? What are their different roles and responsibilities? How can you talk to the hospital staff? Some of the terminology they'll be using. The discharge planning and how you can be involved in that. And a lot of information on medical power of attorney. This is a crucial feature for anyone. So I hope you learn some valuable information from this. Stay with me till the end because I'll give you some tips and takeaways as I normally do. So your loved one's in the hospital. The first thing that will happen is the doctors will run some diagnostics and imaging studies, scans, MRIs, CTs, X-rays. These typically happen in the emergency room when they're admitted. They'll take some general blood work that are both for general health markers and what we call acute labs. For example, if they suspect that your loved one has had a heart attack, they will run something called troponin levels. This tells them if indeed your loved one has had a heart attack. Without a medical power of attorney in your possession that names you as this loved one's power of attorney, you may not have access to all of the labs that they're planning to do or all of the labs that they've already done. That's kind of a scary place for a family to be. So one of the first things when you finish watching this video is you need to download a medical power of attorney for your state. Each state has their own version. and you need to sign it and your loved one needs to sign it. Some states require that these are notarized, some do not. So check out your state's specific regulations. The first thing you need to do when you get to the hospital, obviously, when you're waiting in the waiting room, is you need to locate the hospital's Patient's Bill of Rights. Every hospital has one. Typically, they post them in waiting areas, but if they don't, you can ask the charge nurse or the front desk for the waiting room where you are to please provide you with a copy. They are required to do so. Review this copy in detail. These are the rights and responsibilities that you have as a patient or a patient's representative to be informed about their care. Know your rights. Next, you'll start meeting some hospital staff. You'll meet the admitting ER doctor. This will not be their doctor. This is the doctor that assesses them when they're admitted to the ER. Now, sometimes the hospital is so packed and doesn't have a bed, your loved one may stay in the emergency room for a few days if they need to be admitted and a bed is not available. So get to know their ER doctor. You'll also meet a specialist that has been involved in the care of your loved one. This could be a neurologist if they suspect a neurological problem, or a cardiologist if they suspect a heart problem. Each of the specialists is called in based on the suspected problem that your loved one has. These specialists are separate from the ER doctor. Consider the ER doctor the primary care doctor of the ER. Okay, that'll help. They're kind of overseeing the total picture, and they're also contacting and involving specialties. Then you'll have a charge nurse in the ER. This is the nurse who is in charge of staffing and what the nurses do in the ER. And once you move to a floor, a patient floor or the ICU, this is still the case. There will be a charge nurse. Ask who that is for each shift because the charge nurses change according to the shifts. And meet that person right away. Introduce yourself and tell them that you are there to advocate and oversee your loved one's care. Then you'll meet the floor nurse. This is the nurse that's assigned to the care of your loved one. In the intensive care unit, the ratio of nurses to patients is typically one nurse for every 2 patients. However, that is not the case for every floor. If your loved one is moved to what we call a subacute care unit, this is a step down from the ICU. Typically, these nurses, and the ratio is 1 nurse to 4 to 6 patients. And if your loved one is moved to a regular hospital floor, this can be 1 nurse to up to 12 patients. So it's going to make a big difference how accessible your nurse is. The one that you will have the most access to in any of these areas is the CNA Certified Nursing Assistant or Nursing Tech. These are the staff members who do all of the daily care, hygiene care. They are responsible for rolling the patient. They're really the hands-on, in the room care providers. But recognize that in an ICU setting, a CNA may have 4 patients. In a subacute ward setting, a CNA may have 8 to 10 patients. And on a regular hospital floor, a CNA may have 12 patients or more. So that's just to let you know how accessible these personnel can be. Once your family member is stabilized, they will then receive a referral for physical, occupational, and speech therapies, depending upon their problems, their issues, and their diagnoses. Be sure these are ordered. They are entitled to these, and these therapies can start right away once your family member is considered medically stable. These services can also be ordered in the intensive care unit, so be sure you ask about them. Their role, OT, PT, and speech, is basically to evaluate your family member, not necessarily to provide treatment, but they are critical for deciding what level your family member is currently performing at and whether they'll be eligible for rehab placement. Then you have a discharge planner. Some hospitals call them case managers, some hospitals call them social workers. They can have all three of those different names, but start by using the terminology discharge planner. Talk to this person at least day 2. Things can move really quickly in a hospital situation, and you want to be informed of what they're thinking in terms of discharge. You may also meet the insurance liaison for your particular insurance carrier, your loved one's insurance carrier. Some hospitals have these insurance liaisons on site and others don't. But be sure the insurance liaison knows that you're around so they can talk to you. You also, as discharge is coming up, may have access to the rehab liaison. This is the person from specific rehab centers that comes to the hospital to assess your loved one's current level of function. There are 2 types of rehab, and you're going to learn more about rehab in another part in this series, but I'm going to just skim the surface for this video. Acute rehab placement is for patients who are able to participate 3 to 5 hours per day of pretty intensive OT, PT, and or speech. This is not typical for older patients who've had a stroke or a heart attack or major surgery. So consider that. The next level down of rehab is called skilled rehab. In this rehab setting, patients need to be able to participate 2 to 3 hours per day. This is a more appropriate setting for older patients who've had strokes or major injuries or major accidents, major trauma. So consider that when they're talking to you about acute rehab or skilled rehab. You may even find a home health liaison in the hospital if they're considering sending your loved one straight home from the hospital, which I would almost never recommend, especially if your loved one is over 50 and have been quite sedentary and have several major medical conditions. I would almost never recommend that a family member in that situation goes straight home. So it's very important to talk to the rehabilitation liaison, the discharge planner, and be sure that you're on the same page with them about the potential for your loved one to go home. If the recommendation is they go home and you agree, because again, you have a say, then you need to talk about home health, and you need to ask them to contact a home health agency in your area so that that can be set up for your loved one. This is minimum. I can't really think of a scenario when home health would not be a good idea. If your loved one is going home, you also need to talk about any equipment they might need at home. A walker, a wheelchair, a cane, a bath chair, a toilet chair. These are important, and you need to ask the discharge planner to arrange with a durable medical equipment provider, DME, according to what your insurance covers. Lots to know here. So what is this medical power of attorney I talked about? You're going to hear me really get on my soapbox, because I'm telling you, in the 25 years I took care of my mother, without a medical power of attorney, I wouldn't have been able to do any of it. So what is a medical power of attorney? It is a form that your loved one and you sign that says, if your loved one is incapacitated for any reason or needs assistance in making decisions due to a health issue or an accident or an injury, you are their representative. You are their personal representative. In fact, in some states, and the one I live in, this is the truth, it actually states in the form that in that situation, you are your loved one. In other words, you have the rights and responsibilities that you would have as if you were your loved one. So, one of the things you need to do when you finish this video is download a power of attorney for your state medical power of attorney. You need to sign it, and your loved one needs to sign it. And some states require these to be notarized, some do not. Now, does this mean that you totally take over everything in your loved one's life from now on? No, it doesn't mean that. It just means that if your loved one is either hospitalized or incapacitated, you have the right to make medical decisions for them. You have a right to see the medical records. If you ask to see the chart and they say no, you don't have rights to see the chart, you do have rights to see the medical chart. You have the right to discuss the entries in the chart and the reports. You have the right to review imaging and diagnostic studies upon request. You have the right to consult with the hospitalist. Now, who's the hospitalist? Well, consider the hospitalist to be the primary care physician while your loved one is in the hospital. Your loved one's primary care physician has nothing to do with the care that your loved one receives while they're in a hospital. You have to remember that. So the hospitalist oversees all and coordinates all the care for your loved one while they're in the hospital. Get to know who this person is. So you have the right to consult with the hospitalist on the current status of your loved one, their health, their imaging studies, their lab work, anything concerning their care. You have the right to consult with any specialists involved in your loved one's care. You need to ask them about specific diagnosis related to their specialty. You have the right to be informed ahead of time, not the morning of pending discharge. You need to really continue to check with the discharge planner. Just be the squeaky wheel is how I say it. You have the right to be informed and participate in the choices of rehab settings that your loved one is transferred to. You also have the right to appeal the decision to send your loved one home if you feel that it is unsafe for your loved one to go home. What the discharge planner is required to do is to give you a list of skilled rehab centers or acute rehab centers, and it is your role to select 3 top centers from that list that you would like to be considered for your loved one's discharge. Now, how are you going to know what they are? You're going to take some time while your loved one's in the hospital, and you're going to go visit 3 rehab centers in your area close to your home from this list. Yes, it's a big job, but I think it's a great way to see what they look like, talk to them about what they offer, and this has to happen pretty quickly. You have the right to be allowed to participate in the decision of where to send your loved one. You have the right to be informed about what durable medical equipment is covered by your loved one's insurance. You have the right to be informed of community resources and support if you do take your loved one home. And you have the right to request that if they are going home with home health, that therapies be involved from the beginning of the discharge. You have the right then to request updates and therapy notes and progress reports and current goals from the therapists that are seeing your loved one. That is both in the hospital and once they get home. You have the right to be allowed to observe therapy sessions and ask questions. You have the right to be informed of additional tests that are needed in advance of the tests or procedures being run on your loved one. And you are required to sign an informed consent for any additional tests and surgeries or procedures that need to be done. Final tips and takeaways. I know this is a lot. Believe me, I've been there. It's overwhelming. But I hope this is at least giving you a place to start. You will need to download and sign a medical power of attorney from your state. You need to take this paperwork with you to the hospital. You need to be at the bedside of your loved one throughout the hospital stay as much as you possibly can. And have a notebook with you at the bedside and write down notes. I can't tell you how many medical errors I found and interceded for during my mother's multiple hospital stays because I had written down that she had just had an injection of X medication when 20 minutes later they walked in to give her another one. I could go on and on. You can tell I'm really passionate about this topic. Be proactive. Ask questions. Ask them to print out the patient's bill of rights and give you a copy. Try to think one day ahead. Start day one talking to them about discharge. Visit nearby rehab facilities whenever you can within the first 3 days. Select the discharge plan that works for you and your family member. While they're in rehab, start setting up your house. Don't wait until the day they come home. Contact the DME provider on your insurance and obtain the needed equipment. Rearrange your home for safety and access. Have a walker or wheelchair with you when they are discharged. Set up home health visits and call them on the day of discharge to confirm their start date. Coordinate these home health visits. See, it's a lot. Follow up with the primary care physician. Make an appointment to see them. After home health says that your family member is done with their visits, ask them to refer your family member for outpatient ongoing therapy. Then contact the outpatient therapy organization that is on the patient's insurance and set up an evaluation. Set up community transportation if they're going to need it. Set up pharmacy deliveries that can deliver their medications. All pharmacies are offering this now. Set up a caregiving agency if you need one. There are non-medical caregiving agencies like Home Instead that you can set up to be with your loved one. And set up meal or grocery deliveries if they're needed. I know this was a lot, and this is just part one. Oh my goodness, what is Dr. Tidman doing here? Really, I would recommend you go back through this video and take notes, and you might want to consider getting my books. They're very helpful. Join me as we go on to part 2 next week. Remember to subscribe to my channel and hit notifications so that you'll know when the next video is being posted. And for any questions, email me at melanietidman@gmail.com. Thanks for sticking with it through the whole thing, and I'll see you in part 2 of Caregiving 101.